Good morning. My name is Beth Duffield with the Rutherford County Chamber of Commerce, and we are proud to partner with TrustPoint and Robin Morgan for this presentation this morning. So I'm going to turn it over to Robin at this time, and we are recording this, so we were happy to share this link with you to send to other folks, or it will be available on our YouTube page.
Great. Thank you so much, Beth, and thank you to the Chamber of Commerce for helping to promote this opportunity to have this discussion. I think it's an important one. It's sort of been on my mind for the past 6 months, 7 months. But let me just a point of introduction. My name is Robin Morgan, and I work at TrustPoint Hospital. My role at TrustPoint is I serve as the Director of Clinical Integration. So I wear a couple of different hats where I'm provide some oversight of clinical services, but also assist in business development and marketing. My background is I'm trained as a psychotherapist. I did a master's degree in social work, and before I worked at TrustPoint, I worked as a therapist in the HIV clinic in Boston. So I'm offering this presentation really from 2 different lenses. One is as a clinician, mental health provider, but also as a manager, kind of working from that frame of reference to be kind of informed and aware and conscious about the impact of mental health on our staff. Before we get started, I just want to see how many folks we have on. If we could go around, I always like to know who I'm, speaking to in terms of our crowd. So kind of what industries you're working from and what your role is. So if we could just kind of go around our square and just, if you could just share your name and where you work and what your role is.
I'm not sure where to start. Can you hear me?
Yep, I can hear you.
Okay. My name is Shelley Washburn. I'm the HR manager at the Hot Topic Distribution Center in Laverne.
Okay, great. Welcome.
Morning, I can go next. It's Andrea Stillwell with Interfaith Dental, and one of my teammates is also on. So we're a nonprofit charitable dental clinic, and I'm our Chief Officer of Education and Engagement, and also part of our Culture Warriors team that works to promote that positive workplace culture for our workplace family.
Okay, awesome.
And I guess I'll piggyback on that. I'm Michelle Russell. I'm also from Interfaith Dental. I'm the development director and part of the Mental Health Coalition with partnership with United Way. So happy to be here. Thank you, Robin.
Great. Yes, thank you, Michelle.
I'll jump in real quick. Sorry, I'm video dark this morning. This is Kathleen Tyree. I'm one of the branch managers for the Rutherford County Library System. I'm at the Technology Engagement Center next to Hobgood Elementary School.
Great, thank you. Thank you for joining us.
My name is Shane Payton. I work for WWS, which stands for Wallenius Wilhelmsen Solutions. We are the distributor for Nissan North America. So essentially, basically what we do is as all the Nissan cars roll out of the back of the plant, we catch them and stage them for either trucking or rail. And my title is the EHS supervisor here for this company.
Okay, great.
Kim, you want to go next? Kim, did we lose you? If you have just jumped on, we are doing some introductions. Jamie, do you want to introduce yourself, and then Becca?
Good morning, everyone. This is Becca. My name is Becca, and I work at MTSU.
Welcome. Thank you for joining us.
Yeah, thanks for having us.
Okay. Hi, I'm Jamie Brown, and I'm a teacher at Riverdale High School, and I teach in the nutrition science pathway, but I also have students from the social health services pathway, which is our mental health pathway for students who are interested in counseling and other mental health jobs.
Wonderful.
And I'll try again. My name is
Okay.
Kate Frank. I support behavior for both the Lebanon Special School District and the Murfreesboro City Schools.
Great. So I think
that's everyone.
I think that's everyone. So so I'm going to switch to the PowerPoint to kind of guide our conversation. You know, I've structured some information and resources to go through kind of in a formal way, but I'll stop from time to time to kind of open up for questions or discussions or comments. All of you kind of bring your experiences as well. So this is definitely not just a one-sided conversation. So let me see if this is going to work. Excellent. So as we've all kind of observed, we're in a time, a highly stressful time due to this coronavirus pandemic. And I'm offering, you know, some advice and guidance to help us be the best kind of managers and support each other, you know, our coworkers, our employees, to kind of get through this time together in the best possible way. I think this advice applies to any kind of heightened, stressful time. I think, you know, in our generation, we'll go through lots of different crises. You know, they may be short-term, you know, natural disasters, or there may be, you know, situations like 9/11, you know, a few decades ago. But there'll be times when, as a community, we have a kind of a shared and collective stressful experience, or potentially really experienced as a trauma for many of us, particularly thinking about the current stress with the coronavirus pandemic. You know, there is the potential for illness, there's a potential for death. Many of us may have loved ones, friends who've been very ill, you know, and others may have had you know, friends, family members who have passed away due to this virus. You know, I think worldwide we've had 1 million deaths. We've hit that number, and so it's making a significant impact, and it's certainly not going away anytime soon, as far as the data data shows at this point. So it's in our life and it's impacting us. So just thinking about you know, how it's impacting, you know, us on an individual level. You know, there's continued anxiety just about the spread of the virus, and kind of, you know, the ups and downs and the, you know, the peaks and valleys regarding its spread. And data shows that we are increasingly experiencing symptoms of anxiety and depression due to that, and that's not surprising. Also, you know, this public health crisis has impacted our economy. You know, certain jobs have been lost, and, you know, thinking about the airline industry, just, you know, heard news reports about continued furloughs by multiple airlines due to the lack of travel. So that certainly impacts a lot of people, many folks losing income. And so that, of course, has ripple effects on our economy. But also there's increased stress just due to the disruption in our daily lives. You know, I think the whole social distancing, you know, I think initially we weren't sure how long that would be an aspect of our lives, to kind of have to isolate in our homes, not spend time with friends and family, but that's continuing to be the guidance, and continues to kind of create a new normal for all of us. And so kind of our regular patterns of daily life have been disrupted. Those of us who are working from home, you know, do not have that commute, do not maybe have that social interaction, and just kind of regular patterns of our lives and the things that we do. So there's also been disruptions in access to food, or maybe disrupts in childcare due to outbreaks or related to the virus. You know, that we've had shortages from time to time. Thankfully, I think toilet paper is kind of back to being available in the stores, but you know, there is that kind of heightened anxiety and you know, concern of what you might not be able to access or purchase as a basic daily need. And then as we return to, you know, essential services, you know, looking at the hospital setting, looking at grocery clerks, looking at folks who work in the schools, you know, there is an added stress of those workers who are on those front lines and potentially exposed to the virus more than others who are able to isolate at home. And their anxiety is certainly heightened because of that exposure. Just kind of bringing up some data. I mean, it's certainly not surprisingly that increased stress, the increased symptoms of depression, maybe hopelessness, anxiety, stress, tension, is going to impact our employees. And looking at a poll earlier this year after the outbreak, 70% of employees were feeling more stressed, and that's not surprising. I imagine that number may have increased, but that's significant. So in this particular poll, they reported that they were more stressed in their professional career than any other point. And so this was, you know, this is a real critical moment. And of course it's impacting productivity. That's not surprising. So, you know, this data from this poll as well showed 62% of employees were reporting at least 1 hour lost in productivity, and 32% were losing more than 2 hours. So that has an impact on everything, which I mention it in part because it should be a priority because of the well-being of our employees, but you know, making sure that they're taken care of also impacts you know, the work that we're doing and our sustainability of the businesses that we work for. And you know, another significant study, I'm a data person, so I like looking at this stuff, but this is not surprising information as it comes forward. But Boston University came out with a study earlier this week. They looked at rates of depression before the outbreak and in April, so sort of midway, you know, through the pandemic in April. And the depression rate had tripled. So it went from 8.5% to 27.8%, which I think is really significant. I mean, it's, you know, the isolation, the hopelessness, the unknowns, you know, not knowing how long this period of heightened stress will last is having impacts on our mental health. So, so really, really important data. So, so what can we do to help? I think one of the things to consider is that, you know, employees spend, you know, 40 hours a week or more working. And so, you know, their employer is kind of their second family. So of course, you know, we want to create a safe and healthy workplace, but that just doesn't mean dealing with the kind of the physical health aspect, you know, the enhanced cleaning, having social distancing, you know, having face mask policies or other measures that you are implementing for physical health. But we also need to support mental health. And I think as leaders, managers, we are in a position to model good behavior, to provide, you know, timely, accurate information as much as we can, you know, communicate any changes in our policies and procedures just to, you know, keep information flowing. But we also have an opportunity to kind of use this moment to build our resources and support for mental health, you know, fostering peer support or strengthening the resources that we have to help manage the stress and coping going through this type of event. So one of the, you know, first things you can do is, you know, as leaders, come together and figure out what resources do you already have regarding mental health. So if that is your employee assistance program or other programs that you have, get that information out however best to your, staff, whether it's through email or newsletters, posters, team meetings, making sure that they, employees know what resources are available to them. You can also look at, implementing some additional training, use this opportunity to provide some additional training for your staff. MTSU has a grant to offer training in mental health first aid. So I have a link there for that. And the Suicide Prevention Network has trainings to help with suicide prevention, types of conversations to have for a broad, population, which may include your managers wanting to get that training. So it's an opportunity to kind of pull together and supplement and support with those training opportunities. You might consider taking this opportunity to set up kind of a peer support group, like an employee resource group that focuses on mental health awareness and resources, pulling together folks who are interested and want to kind of work together to find ways in your particular environment that would work best for your staff. And then engage with your EAP provider. A lot of providers are providing different types of services at this time to limit, in regards to social distancing and enhanced precautions. So many providers do teletherapy. There's, text services. Many EAP providers have 24/7 phone lines, for crisis and referrals, and then providing links to online self-care tools like mindfulness apps and things like that. So I'd encourage, to work with your HR, or if you were an HR leader, to work with your EAP provider to see if there's other programs or offerings that you can work together on to share with your staff. And then, I think this is a, I think this is an opportunity. I'm a silver lining kind of person. So I always look at the, opportunities in these situations and these challenges. And this is really an opportunity to reduce the stigma related to mental health, which is really to normalize the mental health impact that stress can cause for all of us. So one of the things that we can do is find opportunities to be open about the challenges that we may be having as leaders. So one poll that I found on Indeed found that 62%, not surprisingly, feel more comfortable talking about mental health when someone in leadership openly discusses it. So, we model that behavior to kind of open up that conversation. We kind of set the tone. So if we're open and discussing about the impact and increased stress on, on our lives, that will help model that behavior for our staff. And also just naming the situation, just being upfront and honest about the stress of the outbreak and that it's impacting our lives and that we are stressed. So just kind of naming the feelings that we're having and how it impacts us on a daily basis. Just, being honest. And, also naming, being intentional about naming mental health challenges. So not just talking about stress, but naming depression and anxiety, specifically, to not kind of say it's a word that we can't say in the office, but these are things that people experience, that we all experience. And certainly a third of us are experiencing right now. And I imagine possibly more than that. So, one thing too is to have those conversations. Often as managers, we may be focused on, performance measures, motivation, kind of productivity oriented conversations. But I think building those relationships and talking about feelings, having those check-in one-to-one conversations with your staff are always important, and especially important in this time. So simply asking, are you okay? Noticing change in mood and stress level, observing body language and, facial expressions and checking in can be extremely beneficial. If you have team meetings, taking that time to check in with everyone, at the beginning, it could be just as simple as kind of going around and how are you feeling today? If you can just name one word, what comes to mind today with how you're feeling. That connection and creating opportunities for connection. And, of course, if you're not working in person currently, if you have those team meetings by Zoom, you can still, engage in these kind of activities and practices, but allowing folks to connect and realize they're not alone. So if, they're working from home and they're feeling isolated and stressed, or they're trying to manage, kind of staying productive, but then they have a child who's doing online learning. So they're trying to keep their, 10-year-old focused on their math assignment, or trying to keep them online with their Zoom education. Just being open about that stress that people are experiencing, so that they can connect and know that they're not alone in experiencing that. So you can also, conduct surveys and sometimes folks are more private, so they may not share, how they're feeling. So, finding other vehicles to find out what folks are needing can also be beneficial. I also always encourage, and it's my style as a manager, to have an open door policy and really encourage those one-to-one interactions, building those relationships with staff to understand what they need and make them feel supported and valued is just so important at all times, but in this circumstance in particular. And I've mentioned as well, kind of we as leaders, we model behaviors that we seek to see in our staff. So if we want, our staff to have a healthy work-life balance, and we're working 12 hours a day, bringing work home and sending emails at 2 a.m., it's going to be hard to expect our staff to be following suit. So I think it's really important that we set those boundaries and take care of ourselves, because we're setting that tone for our staff. So some of the things that you can do, and these are things that, I can say that I practice for sure, is, take a walk in the middle of the day, take a break if you can. Of course, each work setting is slightly different, but if it's possible, make that time. If you have, I encourage, especially in this time, if you need extra support, I think counseling is super helpful. And so if you do have a therapist that you see, be open about making that time, and I think normalizing that we all need that extra support from time to time, especially in this stressful time with the outbreak. Making that time, prioritizing your mental health, and sharing that and being open with your staff. Make the time to take time off and disconnect. Do not check your email when you take that vacation or that staycation. Set that boundary. And again, that models, that healthy work-life balance and self-care for your staff. And then, as I mentioned, be honest about the challenges that you are facing, personally. So if you're struggling with managing, especially I think parents are particularly stressed at this time, and managing, or anyone who's a caregiver is, kind of, I think at an increased stress, kind of managing and juggling the different aspects of our lives, and, whether our child is attending school in person or they're attending school online. Our lives look very different. And so, share that with your staff, connect around that, and be vulnerable. So before I move to the next section, does anyone have anything to add, any comments or feedback they want to share?
These are great. One thing, this is Becca, one thing that I've started doing with my team is during our weekly meetings, I've asked them to keep a personal work journal, and I'll give them kind of a prompt. And right, that's of course not something they have to personally share with me, but I found it gives them permission to, you know, write some of those personal feelings that might be coming up about the stressors that are happening during the day, that maybe they feel like they can't talk about. But then also, you know, just a fun prompt to kind of think about things like, how are they practicing good self-care? What does that actually look like? You know, reflect on that, just little things like that.
Yeah, absolutely. That's great. Yeah, I mean, I think just anything we can do to encourage that healthy emotional expression, you know, it doesn't necessarily have to be shared with us, but just creating opportunities for folks to process what they're experiencing, I think is very valuable. Does anyone else have other feedback or things that have worked in their environment?
One example that we borrowed at Interfaith from Nurture the Next, which used to be Prevent Child Abuse Tennessee, was emotion stations. So Robin, to your point about kind of naming the emotion and the feeling, there was an exercise where we were given kind of key categories of emotions and talking about, are we feeling that? If we are, kind of how are we coping with that? And all of that was recorded and then made into posters that are displayed in both of our clinic locations. So we just thought that was such a great exercise. Like I said, we didn't come up with it, but we borrowed it and have found it helpful for, you know, just naming how you're feeling. So.
Yeah, exactly. I mean, this is such a great opportunity for kind of, you know, building that emotional intelligence and language and expressing our feelings. Great opportunity for that. So that's great. And yeah, certainly don't reinvent the wheel. There's lots of resources out there for sure. Okay. Anyone else want to share before I move to the next section? Okay. So I found this really great resource from the National Center for PTSD through the VA, which may kind of give us as leaders some language on and actions that we can take, kind of considering this as, you know, a collective, we're experiencing kind of a collective traumatic stress. And so what we can do to kind of reduce the impact of that stress kind of going forward is to kind of, you know, do what we can to kind of calm down our stress response system. So, you know, I think when we are chronically stressed, you know, it creates kind of that heightened fight or flight system. We're on edge. And so one of the things that can really calm that down is creating opportunities for connection, but having some language around that. And this stress first aid model is developed from research, which identified 5 essential elements that help individuals better recover from adverse, ongoing kind of chronic traumatic stress. This is just kind of some examples of language, questions, statements, and actions that you can take in your setting, and, you know, to kind of guide your conversations that can reduce the stress and kind of respond using the stress first aid model. So the 5 elements that they identified were cover, calm, connect, competence, and confidence. So I like the 5 C's, I guess. So so cover is, you know, would include, you know, asking questions about how has the impact impacted your sense of safety or security, you know, sort of kind of safety oriented questions and feelings of well-being. And if it has, what can we do to help, or what can I do to help? You know, in terms of from an employer standpoint, making statements about your commitment to employees' health and well-being, and what we're doing to keep you all safe. Because when, you know, when we're that fight or flight system is triggered, we feel unsafe. The threat may be unknown, and we don't know, if we've been exposed, or how, if we get ill with this virus, how it will affect us. I think a lot of the research has shown multiple strains, and it's really extremely variable about how people respond. I've heard different anecdotal stories, and so it's, but there's that sense of lack of safety. And so addressing that, and confronting that, and finding opportunities to create a sense of safety, and communicating through statements and actions can create that, calm down that fear response. And one of the actions you can take that also helps when someone's in this chronic state of stress is providing clear information. So if you can provide timelines and variables, being clear on your decision making and any changes, that's going to help calm down that stress response as well. So allowing people, to your staff, your employees, to feel informed, and so things aren't kind of just coming at them. That can kind of heighten that feeling of lack of safety. And then the second element is calm. So that's more focused on kind of the emotional response. So asking questions about, any changes your staff might be experiencing. Are they sleeping okay? Are they feeling on edge? Are they having trouble staying calm? And is there anything we can do to help? So opening that conversation. And then providing reassuring statements, like there are no set rules for working through something like this. Be patient with yourself. So there's not, I think we may, depending on your setting, we may have high pressure kind of work environments where we have high expectations. And I think reassuring your staff and your colleagues that, there's no set rules, this is the first time we've gone through something like this. We're all kind of figuring it out together, and let's be patient with ourselves. None of us could predict how we would respond to a public health outbreak like this. And so, we're learning as we go. So, and then just in terms of actions, finding opportunities for your staff to talk openly about these circumstances, or creating vehicles for them, whether it's peer support groups, if it's, like Becca was talking about, encouraging journaling, just offering opportunities and, nurturing opportunities to talk about how folks are feeling. And also, that's where the self-care is important as well. The other third piece would be connection. And, I think it's so important in so many different areas regarding mental health, but having that, fostering connections in relationships can certainly reduce stress, and certainly a stressful situation like this can disrupt those connections. So because we're socially isolating or socially distancing, our connections with folks have been disrupted. So we're not seeing people face to face as much. We're engaging in, video communication, which may have its limitations, or we're just, maybe we're online more, or we're having more phone calls and texting, but it's impacting our relationships. And so opening up those conversations about how this situation has impacted how we're talking to each other, and talking about things that help, being upfront about asking if folks need practical support. Do they need additional support than what they have access to currently? So, if things aren't working, if their regular connections aren't working, or if they're not able to have that informal support through family and friends or work colleagues, having an opportunity to encourage them to get more formal support. And then, in terms of messaging, and communication, using language like, we will make this through this together, and emphasizing the value that your staff has and the work that they do, encouraging being sensitive to our colleagues around us, and the importance of talking when you need to and listening when you can. So just fostering those healthy relationships and communication and connections. Finding opportunities, if your staff is working remotely, to find opportunities for them to stay in touch with each other. So if there's opportunities to increase collaboration, just increasing that connection is going to reduce the impact of the chronic stress that we're under right now. So if it's not something that you normally do, just being creative and finding those opportunities to cultivate and nurture those connections. And then, addressing competence, folks may feel like they are not working as well as they had been. And so, addressing that and encouraging, coping skills to be able to manage that so they can feel competent and effective in their work. That certainly impacts mental health, and certainly like someone's sense of self-worth, can impact, symptoms of depression, if they don't feel competent in their work. So having those conversations, having opportunities to help them kind of problem solve about what could help them cope and handle things better in response to the stress. And sharing those resources, in your organization. So whether it's through, posters or emails, if there's, you could do kind of a newsletter on, different coping skills or stress reducing strategies, just cultivating and having those conversations can help folks realize that it's okay to need a little bit of help when you're going through this stressful situation. It's okay to ask for help, and and let's work together to share resources and ways of handling and overcoming what we're dealing with right now. And then along the same lines, confidence. So, under heightened stress, folks may feel, reduced confidence in their ability to do their job. And so, or they may feel challenged with how they feel about leadership and their manager. It's, create a huge disruption. And so having those open conversations, and having those discussions, these are just some of the questions that you could ask to kind of open up those conversations with your staff. And again, just emphasizing that we're taking this one day at a time. Things change from day to day. The guidance and advice changes depending on the data. And just acknowledging that we're doing the best we can in this challenging circumstance. And then in terms of those actions related to that, the check-ins are so important. I think, I'm training a manager right now, and one of the things that I really encourage her to do is having those one-to-one interactions on a regular basis with her staff. I think it's really important for building that connection and trust, so that when a staff member is struggling, they know they can come to their manager and have those conversations and feel supported. Does anyone have any feedback or response to this model? Okay.
Robin, this is Beth. One of the things
Yes.
that we've started doing as a team is, and I stole this from Brene Brown, is we start every one of our team meetings with something that we're grateful for, whether it's work or personal, just trying to stay positive and think about, again, the gratitude that you just mentioned.
Yes, you know, I agree. I think gratitude is a wonderful practice, and you know, especially in a time like this when there's so much to be stressed and feel negative about, finding those opportunities to share those positive news, you know, things that you're grateful for, things that are going well, highlighting those things, which is going to, you know, counteract some of the depressive kind of symptoms and tendencies, you know, that we often have in response to stress. So, and I love Brene Brown. I encourage you all to look at her YouTube videos and read her books. She's great. So, and I think those practices are really valuable. So just kind of to summarize some additional kind of efforts and things that we can do. Just wanted to say a few things that, you know, the workplace is where we turn to each other often when dealing with problems. It's really our second family. You know, we spend more time sometimes at work than with our families at times. And so, and stress, our response to stress can impact everything we value at work. So our sense of control or feelings of growth or productivity, you know, connections with others. So, you know, and I think in response to this, you know, COVID-19, you know, work variables will vary widely. You know, it really depends on what kind of work setting and what kind of industry you're in. So there's really no prescribed response for every setting, I would say. But one thing that we really can do is work on building those relationships of trust with your teams, your staff, and attending particularly to those experiencing intense stress responses. So many of us, just looking at the research, one of the things I've always been interested in is, you know, the impact of trauma and adverse childhood experiences, you know, on mental health outcomes and, you know, later in life. And I think there's been really important research around that. I think the initial research that was done in the late 90s with the Kaiser Permanente Center and the Center for Disease Control for Adverse Childhood Experiences found that 2/3 of our population already have had adverse childhood experiences early in life. And so that sets us up, you know, when, potentially for having challenges when there is additional chronic stress or as we're experiencing this collective traumatic event with the coronavirus, it can trigger a lot of things that folks may have dealt with early in life. So we all respond differently depending on our capacities and our experiences, what we have learned along the way or the support that we've received. But many of us are already coming into this situation with a history of that traumatic stress. And so it may bring up a lot of different types of responses for some more than others. So just kind of some additional things that we can do, you know, offering flexibility, you know, if there's an opportunity to offer remote working, some offices are requiring that, you know, if there's an opportunity to make changes, you know, in positions or provide some flexibility in work hours, particularly with those parents and caregivers that have young folks at home who may be doing the online learning. So if there are opportunities in your work environment, of course, every situation is different with different challenges. Be creative in considering what you can do. Also, like I think along with kind of cultivating gratitude and encouraging kind of highlighting positive events and news, you know, providing support and expressing acknowledgement to your staff and appreciation. I think one of the things that I think is really can be very nice in this age of email and text messages and you know, electronic communication is writing handwritten thank you notes. And so I think that can be really impactful for your staff you know, whether it's an appreciation for something specific they've done in the work environment, or just providing compassion and understanding for something that they're dealing with outside of work. Those kind of handwritten communications, I think, are so valuable in this day and age, especially. They say a lot, and they're personal, and they can be received in, you know, a positive light. You know, it's kind of a tangible thing that someone can hold on to remind them that they're valued. And then, you know, asking questions, getting their feedback and buy-in, you know, is really important. Having that back and forth conversation. This is not an opportunity to kind of reinforce, you know, a kind of a controlling management style. I think it's really important to have those conversations and ask for their feedback, their input, in, you know, if you need to make adjustments to your policies regarding, you know, making some adjustments and flexibility and work structure, or, you know, finding out what they need in terms of needing time off or assistance, you know, if they're seeking mentorship, and, you know, getting their input and not making assumptions of what they need. And then, you know, as I mentioned, I think providing that information is really important, and that helps reduce some of that stress. So whatever you can do to provide timely clarity on any changes in policies, and provide that communication when things change, or you're offering changes to be available to your staff, you know, providing that information as timely as possible kind of it can be helpful, and kind of reduces that feeling of things being out of control. So letting them know in advance if things are changing or you're offering new options for flexibility allows them to plan and feel like things are reliable and consistent and safe. You know, kind of going back to that that model about creating a sense of safety. And then, of course, be patient. You know, many of us are kind of feeling weary of, you know, this this continued stress that we're under. We're experiencing it as well, and it's wearing down on many of us. But I think it's important to remind ourselves to be patient. We're still in it, and if, you know, I think my prediction is that, you know, we'll be in it for another 6 months, maybe a year. So I don't know that there's an end at this point, although that's changing day to day. But you know, this is where we're at, and so I think we have to acknowledge for ourselves as well as for our staff that it's normal to have a stress reaction to this situation, and it's going to take time to return to normal, I think. And we don't really know at this point what the new normal is going to look like. And so that in and of itself, right, creates a great deal of stress. And so I think it's important to name that and acknowledge that and validate that in ourselves. And then I think it's important to take this opportunity to really check in and take note that this may be a time for, you know, increased mental health crises. So it's important to know the resources available, so you can refer your staff member to a higher level of support, you know, professional support, either to the EAP or HR for appropriate evaluation and treatment. I think the research is showing, you know, as I mentioned earlier with the Boston University study, you know, a triple in the experiences of depression among adults. And I know that there's other data that I've seen as well about increased suicide attempts. So it's, you know, of course, depression is associated with suicide. And so I think making sure that we're aware and checking in with our staff and referring them to professional support when we notice a significant change when they start to struggle. These are just two publications that have resources in them that I've provided just as a resource for you to look at. One is with the WHO and the other is at the National Center for PTSD. And then I did want to mention, of course, TrustPoint Hospital has the continuity of care for adults and seniors, and as well as adolescents. And so right here in Murfreesboro, we have mental health resources for, inpatient psychiatric care. So that would be more kind of acute situations. And we have an intensive outpatient program. I wanted to mention that it has an online group. And so if folks are seeking that additional support, intensive outpatient group therapy can be really beneficial. So these are just some phone numbers for you to see. And of course, we have an outpatient clinic. We're actually currently seeing patients here at the hospital. But if you need resources to refer folks to, TrustPoint, of course, is a local resource here in Rutherford County. And then in terms of emergency resources, there's a state mobile crisis hotline, which is the number at the top. And then there's the suicide prevention hotline. And I really encourage you to, I think in terms of reducing stigma and increasing awareness, to have these resources readily available and accessible, so folks can, access them when they need it. So does anyone have any questions or contributions to share?
I just wanted to say thank you. It has been a really difficult time for associates and employees and leadership alike, and I think it is really important to provide this information to people and to, I don't know, I guess just like you said, be patient with ourselves and everyone else during this time. So thank you very much.
You're welcome.
Thank you so much for your time. Thank you to everyone who joined us today. And again, we will be putting this on our YouTube page, and we'll send that link out to you so that you can share with friends or other HR folks that might find this helpful. Hope everybody has a great day.
Yeah, thank you, everyone. Take care.
Thanks, Beth.
Thank you.